Hello everyone. Today we are going to discuss the heart failure. Now in this video we will be discussing only the definition, pathophysiology, types and causes of the heart failure. In the next video we will discuss the sign and symptoms. And in the third video we will be discussing the investigations and diagnosis. And in the fourth video we will discuss the treatment. Now the links of other videos are given in the description. You can watch from there. Now the heart failure. Now what is the definition or what is called heart failure? Heart failure describes the clinical syndrome that develops when the heart cannot maintain adequate cardiac output. Like your heart receives the blood from the body through vena cavas, and that blood when reaches the left ventricle, it is pumped out. Now when your heart is unable to pump that blood, or when your heart is unable to meet the demand of the body, like normally when your heart pump 5 liter of the blood, but when your heart pump less than 5 liter of the blood, like 3 liter 2 liter, then your body demand of the blood will not be met. So this is called the heart failure. Like your heart is failing, it is not pumping out the blood. Okay, and it is the final common pathway for a variety of the cardiac disease. Now you know that heart cardiac output is equal to stroke volume and heart rate. Now if the stroke volume or the heart rate is decreased, cardiac output will be decreased, and this can cause the heart failure. Okay. Now what is the pathophysiology? Frank Starling mechanism. Now what this last state? It is actually the relation between the preload and the stroke volume. Preload, you know that when your heart receives the blood from the body through vena cava, which is called the venous return. Now that blood will come to the left ventricle and during diastole. Now when at the end of the diastole, the amount of the blood present is actually the preload. It is the volume of the blood that is present in the end of the diastole, against which the heart will contract. So that is called the preload. Okay, and the stroke volume is when the amount of blood your heart pump during each beat. So this relation is actually explained by the Frank-Starling mechanism. Now when the preload is increased, like the amount of blood in the heart at the end of diastole is increased, the heart myocyte will be stretched out and it will contract more, and it will increase the stroke volume or cardiac output, like more blood will be pumped out. So when the preload is increased, the cardiac output will be increased. Normal. Now when the preload is increased, it will increase the contractility. Like here normal is like this. The preload is increased, the contractility will be increased, and it will increase the stroke volume. But what happened in the heart failure? This normal mechanism is impaired. Like for the given preload, your heart will be unable to pump out the blood. Your heart will be unable to maintain the cardiac output. Like the myocytes are impaired, they are unable, they are weakened. There are many causes we will discuss, but the myocyte is unable to pump out the blood. Okay, so this mechanism is actually disturbed. Now if this occurred, there are several compensatory mechanisms which is activated during the heart failure. The most common is the activation of the RAS system, renin, angiotensin, aldosterone system. When the heart failure occurs, the cardiac output is low, the blood volume is low. Now this will activate the RAS system, and the RAS system through kidney will retain the fluid, which will increase the blood volume, and that blood will go to the heart, which will increase the preload. And when the preload is increased, like here the amount of blood is increased, here the heart will contract more and it will increase the cardiac output. It will increase the stroke volume. When the stroke volume is increased, the cardiac output will be elevated. Now the second mechanism is the baroreceptor response. Now when the cardiac output is low or the blood volume is low, the brain is activated, which activate the sympathetic nervous system. In the sympathetic nervous system, it increase the heart rate and the cardiac contractility. When it is increased the heart rate, it will increase the cardiac output, and the low cardiac output will be compensated in this way. The third mechanism is when the cardiac output is low for a longer period of time, it will cause several changes in the ventricle, like the cardiac muscle cell will grow and the myocardial hypertrophy will occur. When the myocardial cell increase, hypertrophy occur, there will be greater contraction, and that contraction will increase the stroke volume, which will in turn increase the cardiac output. So this is how the compensatory mechanism occur. But this fail if the heart failure is maintained for a longer period of time. Now what are the types? There are main three types of the heart failure: left heart failure, right heart failure, biventricular heart failure, like both right and left. Heart failure can also be a systolic heart failure, diastolic heart failure. It can also be acute heart failure, chronic heart failure. We will discuss each of them. Now, what is systolic dysfunction versus diastolic dysfunction? Like, what is actually the difference between these two? Now, what actually occurs in systolic dysfunction? In systolic heart failure, the contractility of the ventricle is impaired. Like, these are the ventricle. So in systolic heart failure, during systole, the heart is unable to contract. When the heart is unable to contract, the stroke volume will be decreased, which will decrease the cardiac output, and heart failure will occur. So in systolic dysfunction, there is impaired contractility. The heart is unable to contract during systole, so systolic. And here, when the heart is unable to contract, there will be low cardiac output, or there will be low stroke volume, or reduced ejection fraction, like the percentage of the amount of blood ejected during each beat is ejection fraction. Normally it is greater than 50, but when it is less than 40, it shows cardiac failure. Okay. Now, during diastole, the contraction of the heart is normal. Like you see here, the heart is very hypertrophic. It can contract well, but the main problem is the diastole. Like in diastole, there is less space for the blood during diastole in the left ventricle. So when there is less space for the blood in the ventricle, less blood will come into the ventricle and less blood will be pumped out. So in this way, the stroke volume is decreased and cardiac output is low. So the main problem here is the impaired ventricular filling. Like your ventricle is not filling due to less space for the blood, which is occupied mostly by this hypertrophic ventricle. Okay. Either impaired relaxation or increased stiffness. Like your heart is not expanding, it is not expanding, so less blood will come to the heart, to the left ventricle. And it is the preserved ejection fraction. Here during diastole, the ejection fraction is preserved, like it is normal, it is equal to 50 or greater than 50. Like your heart is contracting normally, but it is not relaxing normally. So this is the main mechanism here. Now, what are the causes of systolic dysfunction? One is reduced ventricular contractility. Now in this case, like MI, myocarditis, cardiomegaly, the left ventricle is unable to contract. Like in MI, the tissue become dead. Like there is reduced blood supply, reduced oxygen, so the tissue become dead, and the dead tissue, fibrotic tissue, cannot contract. So in this way, there is decreased stroke volume and decreased cardiac output. Like in this, you see this is the ischemic necrotic area. So in this segment, there will be no contraction. Now ventricular outflow obstruction. In this case, the hypertension aortic stenosis, they cause left heart failure, because if you see the aortic wall is stenotic are very narrowed here, so the heart has to work very hard to push the blood from the left ventricle to aorta. So if this occurs for a very long period of time, the left ventricle will become hypertrophic, and then the left ventricle myocytes will become weak, and they will become atrophic, and then they will be unable to contract. So in this case, in this way the cardiac failure can occur. Okay, and same occur for the hypertension. So the hypertension and the aortic stenosis, they both increase the afterload. Afterload is the pressure against which the left ventricle has to work or has to contract. So aortic stenosis and hypertension both increase the afterload, and afterload for a long period of time can cause heart failure. And pulmonary hypertension and pulmonary valve stenosis can cause right heart failure. Okay, now ventricular inflow obstruction, in this case like mitral stenosis, tricuspid stenosis, the left ventricle is unable to fill with blood. Like when there is mitral stenosis, like the mitral valve is stenotic narrowed, the blood from the left atria will not come to the left ventricle. Okay, so in this case, when the blood is not coming to left ventricle, the stroke volume will be low, and when the blood is not coming due to the tricuspid stenosis into the right ventricle, the output of the right ventricle will be low. In this case, in this way, the mitral stenosis and tricuspid stenosis can cause the systolic dysfunction. Okay. Next is ventricular volume overload. Examples here are the mitral or aortic regurgitation. Now what actually happened here? You see here that the mitral wall is not closing properly. So during the ventricular systole, the blood will be pushed back from the ventricle to the left atrium. So when the blood during systole is pushed back, less blood will be pumped out, because some of the blood is pumped back into the left atrium. So in this way they can cause the reduced stroke volume and reduced cardiac output. Same mechanism occur for the aortic regurgitation. The blood during the systole of this of the ventricle, the blood from the systole will be pushed back from the aorta into the left ventricle. So there will be left ventricular volume overload, but reduced stroke volume and cardiac output. During the A is the atrial septal defect, the blood will be pushed from the left atrium to the right atrium. So the left ventricle will be receiving less blood volume. And SD cause the right ventricular volume, because the blood from the left atrium to the right atrium will be going to the left ventricle. The right ventricle will be going to the right ventricle, and SD cause the blood pushing from the right ventricle to the left ventricle. So they, in this way, they cause the ventricular volume overload. Last one is the arrhythmias. Now atrial fibrillation and tachycardia. In this condition, the heart is racing very fast, and there is less time for the diastole. Like normally when during diastole, the heart relax and the blood come, okay, into the left ventricle. But when there is tachycardia or atrial fibrillation, the heart is racing very fast. Like there is very less time for the blood to come to the diastole. Okay, so diastole is not relaxing properly and contracting very rapidly, so there will be less time for the diastole and less blood will be coming to the diastole. So, and also during tachycardia, the myocardial fatigue occur when the tachycardia is prolonged, when the tachycardia is occurring for a longer period of time. Complete heart block, and they cause the bradycardia. When there is bradycardia, there will be low heart rate, and low cardiac output. So these are all the causes of systolic dysfunction. Now what are the causes of diastolic dysfunction? So here the main problem is during diastole. So one is the left ventricular hypertrophy. Now you see here that the left ventricle is very hypertrophic. There is very less space for the blood. Okay, so less blood will be coming during the diastole. So heart is not relaxing properly. Like there is very less space for the blood. So less blood coming, less blood will be going output. So low cardiac output will occur, and this can cause the heart failure, diastolic heart failure. So here the systolic function is good, but there is poor diastolic filling. Okay, and hypertension leading to myocardial hypertrophy. Myocardial hypertrophy is mainly occur because of the hypertension. So hypertension increase the afterload, and afterload is increased when they can cause myocardial hypertrophy, and this is the most common cause of diastolic dysfunction. Next is constrictive pericarditis. Now you see here is there is the normal pericardium covering the heart, but when the pericardium is like very thick and the pericardium is not relaxing with relaxing the heart. So when the pericardium is very thick, the heart will be not relaxed, and when the heart is not relaxing, less blood will come into the heart from the body, and when less blood is coming, less preload is coming, the cardiac output will be automatically low. So constrictive pericarditis prevent the heart from relaxing, and when the heart is not relaxing, cardiac output will be low. So mark fluid retention will occur because the blood is not coming to heart, so they will retain back in the veins, and this can cause peripheral edema. Like they increase the interstitial pressure, and when the interstitial pressure is increased, the fluid will move out of the vessel, and that can cause the edema, ascites, pleural effusion, and elevated jugular veins. Same mechanism occur for the restrictive, but here the ventricle are restricted. Like the ventricle here are the restricted due to deposition of the protein like amyloidosis, sarcoidosis, hemochromatosis. The ventricle are not relaxing, they are stiff, they are not relaxing. So when they are not relaxing, the blood during diastole will enough blood during diastole will not come. Okay, so this is how the diastolic dysfunction occur. Now when the blood is not coming to the ventricle, they will be retained in the atria, and they can cause arterial enlargement. So restrictive filling pattern, high arterial pressure. Next is the cardiac tamponade. The blood in between the pericardium accumulate, and which is called the cardiac tamponade. So during cardiac tamponade prevent the heart from the relaxing, and they put pressure on the heart, so the heart is not relaxing, so less blood will come and less blood will go out. So that is why they cause diastolic, like less blood is coming during diastole into the heart. So less blood is going out, so they will cause hypertension and elevated jugular veins because the venous return is not occurring. So the blood will be retained in the veins. Similarly, palsy paradoxicus and poor urine output because the cardiac output is low. Now what is high cardiac output? Heart failure. Here the heart failure occurs because of the high cardiac output. Like the heart by itself is normal, like there is no problem, no disease in the heart by itself, but due to some other condition, heart failure occur. Okay, in high output heart failure, an increase in cardiac output is needed for the requirements of the peripheral tissue for oxygen rarely cause heart failure by themselves. Okay, now if this condition develop like this, or if this develop in the presence of underlying heart disease like MI, arrhythmias, valvular disease, heart failure can result very quickly. Now what are the causes of the high output heart failure? Chronic anemia. During chronic anemia, the body is receiving less oxygen, so this put high pressure on the heart and a high workload on the heart. So the heart increase the heart rate, contractility, and cardiac output, and this eventually result in the heart failure. Like also the pregnancy. In pregnancy, the blood volume is increased, and this cause increased preload and this put increase pressure on the heart. So this can cause the high output heart failure. Similarly, hyperthyroidism can cause the increased BMI, increased oxygen demand. In this way, they can cause heart failure. IV fistulas, they increase the preload. The blood directly go from the arteries to veins. So they increase the preload, and when the preload is increased for a longer period of time, this can increase the cardiac contractility, cardiac hypertrophy, and eventually the heart failure occur. Weight bearing caused by thiamine deficiency or vitamin B1 deficiency. So during vitamin B1 deficiency, the carbohydrate metabolism is impaired. So the heart will be not obtaining energy from the carbohydrates because the metabolism is impaired because of thiamine deficiency, and this can cause uh, heart failure. Paget disease operates in a similar way, and they can cause calcification of the walls, and they can also increase the heart contractility. Mitral regurgitation and aortic insufficiency can also cause the high output heart failure. So in the next video, we will be discussing the sign and symptoms. If you have any query, please ask in the comment. Thank you.